Hi, it's Dr. Adrian from Advanced Dental Artistry. If you're considering getting cosmetic dentistry done, and this can be anywhere from a few porcelain veneers all the way through to a full smile makeover, and even having all of the teeth done in porcelain, it can be very confusing to actually understand what is the quality difference between the different types of porcelain, and of course what's the outcome going to be. And of course there's a cost variation when it comes to this treatment. We've been doing this treatment now for over 20 years, and not only do we lecture internationally and in Australia, but we have really refined this process down to a fine art. There are three very important things to consider when getting this treatment done. The first is that we're technology leaders when it comes to this treatment, and this means that we embrace technology to make the result more predictable but more comfortable for the patient. One of the things is intraoral scanning, where we're able to, instead of taking molds and impressions of the patient's mouth, and we know that this is uncomfortable for the patient, but it's actually very inaccurate, because not only do we get shrinkage of the impression material, but we can also get expansion of the plaster that goes into making these models. We can actually use intraoral scanners to scan the patient's mouth to make it much more comfortable but much more predictable, because we get an accurate copy of the patient's mouth in 3D. This is then placed into a computer system where we're able to actually use artificial intelligence not only to do a digital smile design of the patient's face, but to actually in real time select from natural libraries of teeth the best smile to actually suit that patient. And then it comes to the second part. We then use that software to 3D print a model of the new smile, which we then can do to create the trial smile. And this trial smile is critical. We really want the patient to trial run their smile before the porcelain's actually made, so the patient can then see exactly what they're going to get. Not only the shape, the form, the symmetry of the teeth, but also the color and the placement of the teeth, and also the bite. And this is important because we really want the patient's feedback when it comes to whether they are 100% happy with their smile. And the third thing is the artistic eye. We use all of this and combine this technology in order to actually give it to the person that's making the porcelain for you, and that's the dental ceramist. Now, dental ceramists here at the clinic have over 40 years of experience making porcelain veneers, and they spend hours actually making one porcelain veneer. It's very important for the patient to actually meet the ceramist, but to also have the ceramist on site, so they're able to do subtle changes to the porcelain so that the end result is actually better. By actually meeting the patient, they can then ask questions to the patient when it comes to the shape or form or color of the teeth, so that we can ensure that the end result is perfect. In the end, the most important thing is a strong connection, trust and communication with not only the dentist and the team, but also the ceramist who's actually making the porcelain veneers for you. If you have any questions, please leave them in the comments below. We look forward to one day seeing you in the practice.